Hi, my name is Rachel Smith. I am a flight nurse with Vanderbilt Life Flight. I've been flying with Vanderbilt for a little over 2 years. I have worked for Vanderbilt for going on 13 years this year. So I have a bachelor's degree in nursing, and I have a few years of ICU experience, ER experience, and pediatric experience. For this job, we like people to have those particular things because of all the different patients and illnesses and injuries and things that we see. Some of the things that we do every day, obviously we go to hospitals and pick up patients and take them to other hospitals. We don't just go to and from Vanderbilt. We also, if there's an accident somewhere, whether it be a car wreck, four-wheeler accident, fire, anything like that, if the EMS service needs us, they call us and we show up there. When we're not flying, we do tons of continuing education. Unfortunately, in this job, it's not where you get to just kind of relax. We constantly go to classes and computer training. So we're always trying to learn more so that we can take better care of our patients. All right, so this is kind of my office. This is one of our aircraft. We have 3 different kinds of aircraft, so they all look a little bit different. And we also have a plane. Most all of us are trained to work on the plane as well as the helicopter, and all of us can work on any of the helicopters. So this particular one is an EC-135, and this is our workspace. So our patient goes here. This monitor sits up here, and this is kind of our workspace. So if we have to do anything with the patient, we are down here in the floor. So you have to kind of be able to move around. If they have anything that's going on that's below their waist, we have to kind of climb down in here to be able to help them. So it's kind of a tight space, and we're bumping around. We wear a helmet, so it can be kind of loud. So there are a lot of different things going on back here when we're taking care of people. The thing I love most about my job is obviously helping people when a lot of times they're having their worst day ever. I love that I can be there to help them, to get them where they need to go. And I have a great partner that I work with, and we just really get to use our brains a lot and think through things and try to do a lot of problem solving. I would say the hardest part is the responsibility, just because you're taking care of someone's mom or dad or child, and you always want to do what's best for them. And so it's really hard sometimes to have that responsibility, but it's probably also the most important part of it. I would say a lot of what we use in this job, we use a ton of critical thinking, problem solving. We don't always have the exact equipment we need, so we may have to kind of make things work. We work in a small space, so we have to kind of be creative on how we do things. We do surgical procedures in the aircraft. There's not a lot of room, and so we have to kind of think through things and figure out a way to do it. And also just being adaptable, because it's always different. Every patient is different, every scene is different, every hospital is different. So we're constantly having to kind of adapt and change to fit our environment. Tips or advice, anybody wanting to do this, do it. It's the best job in the whole world. But definitely, become a paramedic, become a nurse, and learn as much as you can, because you can never learn everything, and there's always going to be a situation where you don't know about that. So just learn as much as you possibly can.